Good afternoon, everyone. Thank you for joining me on this lovely Wednesday fall afternoon. Before we begin today to talk about COVID-19, I want to talk about the all-important topic of the 2020 census. We now only have 2 weeks left to make sure that every single person in our community is counted in the census. A census that makes a huge impact on our community when it comes to health care, food assistance, education, transportation, housing, community development, and so much more. The response numbers for this week remain as they were last week. 72% of Erie County households have responded, and within the city of Erie, it is 64% of those households. So I ask all of you, if you have not responded, to please do so at my2020census.gov or call 844-330-2020. It takes less than 10 minutes to do this. If you need assistance to complete your census, you can visit the following locations. Almeda Supermarket in Erie is doing census count right now as we speak on Parade Street until 5 o'clock today, and again tomorrow between 3 and 5. Dobbins Landing, you can go down there to the dock in Erie along the bayfront from 6 to 8 on Friday, as well as next Friday from 6 to 8. The Booker T. Washington Center is having a special event on Wednesday, the 23rd, 1 week from today, where you can also register to vote, enjoy some refreshments and prizes. So as I said, time is running out, so please respond to the census and make sure that those in your close relationships, your family, your friends, your neighbors, do so also. Now for an update on COVID-19 here in Erie County. We have 4 new cases to report as of late last evening, which brings us to a cumulative total of 1,439 positive cases since the first case in March. 35 of those cases are currently active. 1,356 have recovered, and to date, we've had 25,484 negatives and 48 deaths reported in the NEDS database. Of the cumulative cases in Erie County, 58% are female and 42% are male. The breakdown by age is as follows: 3% ages 0 to 4, 2% ages 5 to 9, 6% ages 10 to 18, 16% ages 19 to 24, 37% are ages 25 to 49, 18% are ages 50 to 64, and 18% are ages 65 or older. Regarding race and ethnicity, of our cumulative cases, 63% are white, 21% are African American or Black residents, 7% are Asian residents, 2% are other, and 6% are unknown. Regarding Hispanic origin, 7% are Hispanic of any race, and 83% are non-Hispanic, and 10% are unknown. To clarify some information regarding our data, the cases that we report today and every day are actually yesterday's numbers that were reported prior to midnight. Live data is always being cleaned as it comes in and as time goes forward. So there will be times when the numbers do not exactly match maybe other numbers that you see, but eventually this all gets reconciled. So think of it working similarly to your balance on your checking account. You receive that bank statement every month, and hopefully then you sit down with your checkbook and your receipts and you reconcile your account. To further expand on data and to talk about other things within the health department, I'll now turn it over to Director Melissa Lyon from the Erie County Department of Health. Director Lyon?
Thank you, County Executive. I appreciate being on today's press conference. So there have been inquiries periodically throughout the pandemic regarding daily data reporting and the small changes in the daily counts from time to time. I really like the checkbook reconciliation example. I think while this may appear to be a simple task of collecting data and then reporting it out, it is really much more complex. Consider it a fluid process of data review, and it's conducted by a number of people. There are biostatisticians, there are epidemiologists, and data entry managers. They're continually reviewing the data, and they're checking for things such as duplicate cases, accurate addresses, correlating laboratory reports, etc. And this all takes time and diligence, and it doesn't happen immediately. We have to commit time and energy to review that data. So for example, an individual may need a negative COVID-19 test prior to receiving a medical procedure. If they test positive, they would not be able to receive that medical procedure until they have a negative test. So they would need to return for a second or possibly third test. One or two of those may also be positive due to presence of viral material. What we would not want to do in this case would be count that person's test results 1, 2, or 3 times. Therefore, it would need to be deduplicated. We would have that as one case, even though there may be 2 or 3 laboratory reports in the system. Another example would be a college student case is assigned to the county or jurisdiction where they are living at the time of the test. However, we all know with COVID-19 and the virtual learning options, this can sometimes take time to determine exactly where they are living. If we find that they are living in another county, that case may transfer out of Erie County, which had been counted in Erie, but we need to transfer it. So those are examples of where 1 or 2 case counts per day may change based on cleaning and reconciling that data regularly. So I hope that that brings a little clarity to how data collection and reporting happens here. Another thing that I wanted to bring up, because I know it's on a lot of people's minds, is how are we going to safely celebrate our holidays? And Halloween is the one that keeps coming up in questions and discussions. So I wanted to let the public know that today on a state call with the Department of Health, they had mentioned that some general guidance will be coming in the future on how we can enjoy our holidays safely. And as I'd mentioned in earlier interviews and press conferences, I believe Halloween celebrations will be decided on a local municipality decision, such as if there are things such as parades, they may be discouraged because that could be a larger gathering than would be allowed. But trick-or-treating may be allowed to happen safely because individuals are wearing masks appropriately. They could display candy on tables, maybe not place the candy or snacks in bowls. Parents and children can select one item at a time. We believe that there is a way to celebrate our holidays safely. So again, there will be some guidance forthcoming. The Erie County Department of Health is always willing to assist any event planner or municipality that might have questions around their events. Lastly, there are job postings to join the Erie County Department of Health. They can be found at eriecountypa.gov. You would click on the careers button and the apply now. There are currently 8 postings showing. They would be identified as ELC Enhanced Detection. That actually stands for Epidemiology and Laboratory Capacity and Enhanced Detection. They are public health jobs. The postings will come down on, I believe, September 18th. And so if you are interested in applying, please do so. We encourage everyone to come join our team and be part of our COVID-19 response and recovery. With that, I hand it back over to you, County Executive. Thank you.
Thank you so much, Director Lyon. And if you have those skill sets, Melissa Lyon is a great person to work for. So please consider joining us in Erie County. And now we're going to open it up for media questions. Because of the federal court ruling this week, I have also invited County Solicitor Richard Perhacs to be available today to answer questions particularly related to that issue. So if any of the media want to ask him a question, I want you to know that Richard Perhacs, County Solicitor, is also on with me today. So let's start today with Erie News Now.
Hi, good afternoon. Can you hear me?
I can hear you, Ethan. Thank you.
Alrighty, thank you. Question for Solicitor Perhacs. Solicitor, what would your advice be to local business owners who get bombarded with this information? They hear about a possible rollback of these restrictions or them being perhaps declared unconstitutional, but at the same time, things are still being enforced. What's your advice to local business owners?
The county's advice is that the most prudent course of action for a couple of reasons is to maintain status quo and continue to adhere to the regulations as they relate to capacities and occupancy rates and so forth and so on, for a couple of reasons. First and foremost, the medical advice that those regulations were based on still remains the best available advice from medical professionals regarding what will help to contain the spread of the virus and to best assure the health of the public. And that's a medical determination or epidemiological determination, totally apart from the law. On a more practical level, the status of the decision is still a bit in flux. The legal system sometimes takes a while to work through itself. The state has announced publicly that it intends to appeal the decision to the Third Circuit Court of Appeals, and I have no doubt they'll do that. They may have done it already. If they haven't done it, they're going to do it very quickly. The decision itself does not address the issue of its effective date, but the taking of an appeal will raise the question of whether a stay will be put into place on any impact for the decision. Stay can be requested either from the court that issued the award, the Western District of Pennsylvania, or to the Third Circuit Court of Appeals. Either court can issue a supplementary order that would effectively stay enforcement of it. I would be really surprised if the Commonwealth does not request such an order. But again, they haven't done it yet, at least not that I've been informed of. If they've done it, it hasn't been reported in a fashion that's gotten back to me. So it would be rather problematical, I think, to change, for business to change its approach to access, for example, only to have it 24 hours later have the regulations put back into effect and therefore confuse their patrons, customers, and the public. So our advice would be to give this matter a few days to settle in, and let's see what the actual legal situation is. And of course, our underlying concern remains the health of the public, and the advice that the restrictions were based on remains the best, as I said, the best available advice from the epidemiologists who know certainly far more about this than I do. So that would be how we would respond to inquiries. As far as the county taking enforcement action against somebody who disregards the regulations now, frankly, we haven't had to do that yet with respect to the regulations, because we've had excellent cooperation from the business community with respect to the things that we feel they should be doing and the things that the state said they must be doing. I would hope that would continue, and people would examine their policies with respect to access and opening up in light of that.
Thank you, Rich.
Listen, quick follow-up there. If I were
Sure.
a business owner right now, if or until a stay is granted by a court, would I face any repercussions for reopening entirely?
Melissa, you want me to address that for you? I think that's more of a legal question than an administrative question, if you'd like.
Yes, I was hoping that you would. Thank you.
Well, given what the opinion said, if somebody opened up tomorrow, and on the basis that, well, I'm allowed to do it because this opinion says that, what are they going to? And there's a legal action initiated by my office against them, or some sort of penalty assessed under other remedies that the county has available to it. By the time that matter gets in front of a decision maker, the stay is granted. Now you're going to be liable, potentially. So you really want to run that risk. It doesn't make a lot of sense. It makes a lot more sense just to wait a little bit and let the legal landscape settle out a little bit so that you know. But is it possible that a sanction could be imposed and later enforced because the effect of the decision turns out to be extremely short-lived? Yeah, that's possible.
Thank you.
Thanks.
Talk Erie, Joel.
Yes, another question for the county solicitor. Back in May, a local woman was arrested by Erie County deputies and incarcerated over the weekend for breaking a signed isolation agreement. Can you confirm, Mr. Perhax, if any other Erie County citizens have been detained for defying health orders?
Not to my knowledge, and I think I would know. I was certainly
Okay.
involved in that one. No, we've had generally very good cooperation from the people that have been affected by those orders.
Do you know of any other cases in the Commonwealth where arrest was made in violation of health department isolation or quarantine orders?
I have no specific knowledge of any cases, no.
Okay, thank you, sir.
Thank you. Erie Times News.
Hi, Kathy. It's David. Just to go along this track a little bit, has specifically within the last day or two, have either your office or the health department received any questions from school districts about football games this weekend and whether they're going to have allow fans in attendance or whether they're asking if they could?
I will turn that over to Director Lyons to answer from that division.
Thank you, County Executive. We have been receiving calls throughout the week around what this could mean for gatherings, and we are staying true to the original orders of no outdoor events greater than 250, indoor attendance of 25 capacities, same with all of the bar restrictions. So at this point, the phone calls that we have been receiving, we've not been advising them differently than we had prior to the ruling. Thank you.
Sure. And a different question, Melissa, also for you. We've seen the local college numbers are pretty low, but there's an outbreak at Penn State main campus, quite a few cases. How big of a concern is there with all the Erie County college students that go to State College, go to University Park? Is this something we're tracking locally because there might be some local kids involved, or how big of an issue is this?
So for clarification, you're talking about an outbreak on main campus, is that correct?
Right, main campus, not Penn State Barron, talking about University Park. They're seeing quite a few cases at Penn State's main campus. Traditionally, a lot of Erie County students go there for school. Is that something you guys are tracking? Do you get information on the Erie County students that might be involved? And do we have any idea if there's quite a few that are among the outbreak at University Park?
So as I stated earlier, the case would be where the student is primarily residing. So, for example, if it is an Erie County resident that typically lives here in the summer months, let's say, but they are attending main campus and living at Penn State main campus, they would be reported in that county. So in reality, we may not always know about that particular case because we wouldn't be responsible for contact tracing and isolating and quarantine unless, for example, they had contact with someone that lives here, let's say a parent or grandparent, brother, sister, so on and so forth during their infectious period. So the long answer to your question is, Penn State main campus cases will stay primarily related to that university. Now, from the conversations I've had with the universities on a fairly regular basis, is they're discouraging travel, unnecessary travel to other locations within the state or country. That way they can keep their case counts as low as possible. So that was a long answer to your question, but I hope that information was helpful.
Thanks, Melissa.
Thank you, David. And I guess I will just put out a call to all of those listening who have students in colleges and universities across this country is ask your student to stay there until it's time to come home for their end of semester break. We all know that it's better if people don't travel around much. So to that point, it's really best if they don't come home. I know many students like to come home for different weekends, but this year, I encourage them all to stay put for the semester. And now we'll turn it over to Jet TV.
Hi, Kathy. Your response to knowing that some of these businesses and restaurants that had closed because they became a victim to COVID-19 and now a federal judge ruling Governor Tom Wolf's restrictions as unconstitutional.
Well, as we said, that was a judge's ruling here in the Western District of the federal courts. There will be a challenge to that by the state government, we believe, and so we will see what the final result is on that. So I have no other opinion on that at this point.
Okay, thank you.
Sure. And we also have with us today West County Journal. I believe Sandy is with us.
Yes, thank you. I want to go back to Melissa talking about the trick-or-treat hours. And there's a hierarchy of who's in charge of what. And I know the local municipalities are in charge of whether they have it or not. And are you getting guidance from the state? And what will you be providing to Erie County municipalities as far as county-wide?
Director Lyon?
Thank you for the question, and you are correct. As of today, on a call with the State Health Department representatives, they indicated that they would be putting forward I believe it will seem fairly general, but some guidance that we will then share with municipalities once we've received it. Again, it is a local decision for each municipality to decide how they are going to set their hours, if they're going to host them at all. But you've heard me as well say I think that this is an activity that, if well executed, can be done safely. There are particular activities that maybe we would discourage if they were indoors as opposed to an outdoor activity, but we are looking forward to working with municipalities to help them make the best decisions so that everyone can begin to enjoy the holidays that we look forward to in the fall. I hope that is helpful.
Yes, and as a follow-up, if I may, will Erie County put more directives or more guidance on top of what the state does, or are you just, going to funnel from the state to the local groups?
Honestly, I will have to wait and see what the state puts forward. If it seems to be comprehensive, then I would say we wouldn't make many changes to that guidance. If it seems that it could use some additional interpretation, we are always happy to do that from the Erie County Department of Health. And then we stay consistent as we communicate with others in the county that seek that same guidance. Thank you.
Thank you. And I'm just going to add, I think with every one of these holidays and the guidance that comes out, all of us in our own individual lives and worlds need to understand where we're comfortable and what we're willing to be involved in and what we're not. And I hope that everyone has compassion and understanding. If your neighbor decides they're not comfortable doing Halloween this year and trick-or-treating and they shut their lights off and keep their doors closed, that we would all respect their wishes and also respect the wishes of maybe if your neighbor is somebody who wants to be part of Halloween and you don't. So please, everyone, show compassion to each other. We all have our own levels of comfort when it comes to COVID-19, especially when it comes to any kind of gathering. And now we'll go back to Erie News Now.
Question for you, Director Lyon, regarding local school districts with all students now back in class, be that online or in person. Any lingering concerns or biggest issues that you still keep an eye on here with schools now back in action?
I think every school district should be very proud of the hard work that they did over the months of the summer planning, whether they've gone partially back to in-person learning or all virtual. That was a very heavy lift, as I would refer to it as, and they should all be very proud. The cases related to school districts have been small, and that would demonstrate all of the hard work that everyone put forward. I will continue to watch the numbers as they come in related to school districts, and if anything becomes alarming, we have great working relationships with the IU5, the superintendent organizations, as well as school nurses. So I'm feeling very confident that collectively we'll be able to respond rapidly should we need to. But so far, the hard work that they've all put into this is proving to be successful. Thank you.
Thanks.
Talk Erie, Joel?
Yes, hi. This is for Melissa. I'd like to follow up on some reporting that David Bruce had this morning in the Times News. He quotes a bakery owner out in Fairview, and she says, it's different from everyone. Say you have an official capacity of 400 people. You could have up to 300 if you're Walmart, 100 if you're a restaurant, and 25 if you're having a wedding. quote, it makes no sense. Melissa, can you walk us through all those differences and how it makes sense for your enforcement team?
Well, the numbers that she was quoted at were not accurate numbers, if I'm understanding how they were printed. As far as the guidance, Joel, it's not changed. So you cannot have more than 25 indoors for a particular event. The capacities of 50% or 25%, they're all very well spelled out, and I don't think it'd be a great use of our time today for me to go over those. But we're always happy as the environmental team to answer questions as people have them. Thank you.
Thank you.
David with Erie Times News.
Sure, Kathy. We've been tracking the zip code numbers through the State Department of Health website, and there was a bit of an achievement yesterday where the 16503 zip code, since we've been seeing the zip code level numbers, had had the most cases in the county. Yesterday, it was surpassed by the 16510 zip code. It now has the most cases. I just want to get reactions from you and Melissa on that. Does that have to do with, as far as you guys know, all the outreach that's been done in that particular zip code? Is there concerns about what's going on in the 16510 zip code? I just want to get your thoughts on this development with case totals.
Well, first of all, I'll react in the fact that I think there was a lot of great work done by the partners who work closely with the staff at the Erie Department of Health, Erie County Department of Health. These partners out in the neighborhoods have been really doing a great job, I think, getting the message out there and helping get the resources out there that the people needed to really help contain the virus within that 16503 zip code. What I've been seeing is that this virus continues to spread throughout Erie County, maybe in a much more even fashion than it did for a little while. And I know there was maybe some false senses of security from people who lived outside of, let's just say, the city limits or within the more urban core. But what we're seeing now is a lot of cases in some of those more rural areas. And as we've always said, this virus is always looking for a new host, and that host can be anywhere. And people do travel around a lot in this community to work, to shop, etc. So I think that is really kudos to those who've helped to stop the large spread we saw in 16503, but caution to everyone who thinks somehow this virus won't affect them. And I'll let Director Lyon speak to that.
Thank you, County Executive. And frankly, you answered the question as I would have answered it. I don't have anything else to add on that one.
If I could just follow up on that then, are there plans to do any kind of the outreach in the 16510 or other, it seems like the zip codes that are having higher number of cases are all adjacent to 16503. It's all in that kind of one area of the county. Are there any plans to do any similar outreach into the 16510 zip code, whether that is East Erie or Mill Creek or Lawrence Park? It's a zip code that straddles a lot of different, a city, a borough, and a couple of townships. Do we know of any plans to do outreach in that specific area?
To answer this question, David, it's not as if outreach begins and then stops and then starts up again around a new zip code. The outreach is happening continuously, and what we do is we will tweak our strategies, either asking additional partners to join us. Partners may reach out to us. We may have to do additional language translations. We may target different populations. So to answer your question, it's yes, we're constantly looking at our numbers and assessing, are there areas that need additional assistance, additional information, new ways of receiving the information, and we work to strive to accomplish that. An example would be Hammond Health Foundation is doing a lot of work around data collection and working with the city to do promotion around mask wearing and staying in compliance. And they did an outreach event here at the West Bayfront area about masking, and they used materials that were created and or collected by the health department. So we don't stop and start our outreach efforts. We actually are doing those continuously. So the answer long is yes, we're working with all of that. Thank you.
Thanks.
Jet TV, Star.
Hi, Kathy. Do you have an update on the CARES Act funding? How many people have applied for that so far, and how things are going within County Council and your team?
We're really happy with the amount of entities that have applied for the funding. So we closed down the application period for both the small business grants and the nonprofit grants yesterday. And the personal protection equipment grant opportunities are still open to the end of the month, as are the municipal reimbursement grants. We had 249 businesses apply for the small business grants, and we're hopeful that we can fund all of them. But we're diving into that as we speak, so that we can make sure that every one of these businesses is eligible under the guidelines of the CARES Act. With the nonprofits, it looks like we may be able to do a second round in the nonprofits, but we're going to see again how this all pans out. And so we may be doing a second round, but with the small business grants, at least right now, it looks like the requests are so numerous that we may end up utilizing all the funds in that. But we're hopeful that these grants will help our businesses stay afloat, as well as our nonprofits. And I have to say that many other counties have told me that they're struggling to give away this money, that they haven't had applicants like they thought they would have. In Erie County, I give credit to all those who helped to market this, and then all the businesses and the nonprofits who took the time to fill out an application. And we hope to turn this around fairly quickly and get this money out to those very deserving entities.
Thank you.
Sandy from West County Journal.
Hi, I would like to go back to school being back in session. And in the Fairview School Board meeting the other night, I think you were asked, Melissa, about the increase in children getting COVID-19. Has there been an increase? Have you seen yet since school has been back in session?
Director Lyon?
I believe I understand the question to be, have we seen an increase in school-age children since they've returned to school? There has not been a remarkable increase, meaning a trend going in the upward direction that would be overly concerning with school activity. So at this point, the schools and the work that they've done and how they're implementing their plans is working to keep those numbers at a place that is comfortable, not seeing large outbreaks at any buildings or school districts at this point. I hope that answers your question.
It does. Thank you.
And we'll go back to Erie News Now. Do you have a final question?
I do. One last one for Director Lyon, please. Regarding our recent numbers here over the last handful of weeks, which seem to have been quite low, very manageable. Obviously, nobody has a crystal ball. Things can change in an instant. But does seeing this continued trend of relatively low case numbers inspire a little extra confidence in you?
I was just going to say, I'd love to say that we were in a place to be able to celebrate that we'll stay this low. I've said this, I think, a number of times, just how pleased the health department is with the work of the businesses and the school districts and the general community and the healthcare workers. And everyone has really been doing their due diligence and working hard to keep our numbers low. They have, and it's showing. So I'm going to actually weave in a little bit when, a judgment comes out that certain things are unconstitutional, and then the guidance or rulings then make things a little messy. That's discouraging. So I've been encouraged by the numbers. When things get a little messy or hard to interpret, that's discouraging, because we may go through a period of time where people change their behaviors, and that may put us at risk of having more disease spread happen in the community. We're also moving into winter, so I don't want anyone to feel like this is a time to be complacent. We must continue to do what we know that works. Erie County is clearly demonstrating that when we mask appropriately, we follow the guidelines, We don't gather in large groups or for long periods of time. We do a lot of things outside for as long as we can. Our numbers stay low, and we're going to have to work really hard in the coming months. So I hope that everyone can continue to persevere. Thank you.
Thank you. Joel with Talk Erie, do you have a last question for us?
Just a real quick one from Melissa. Wondering about 10 days out from Labor Day. Have we seen any kind of a spike? Also, it was a big travel day, the biggest of the year so far. Anything happening via the airport or the bus station?
So far, it's looking really good. So 10 days out and not a large spike in new positive cases. We still have to get through day 14, as we know that can still happen, but it's feeling pretty good right now. I can, make a general comment that I think a lot of people spent their time enjoying outdoor activities for the most part, and it seems that outdoor activities result in, we don't see as many cases associated with outdoor activities. So we're feeling pretty good right now. Thank you.
Thank you.
And David with the Erie Times News, do you have a final question?
Yes, Kathy, and this is for Melissa. She's mentioned about being in contact with the school districts. Melissa, how is the health department notified about cases in the school districts? Can you take us through that briefly? Because we see how the colleges are notifying the public now. All the four college and universities in Erie County have these boards where they post the number of cases. How do you guys hear from the school districts about their cases?
So keep in mind that actually it's a laboratory confirmed case, and so when the universities are very different than the school districts, universities, some of them in the area are doing surveillance testing themselves, and therefore may know those test results sooner than we would as a health department through the typical reporting system. So the communications with the universities is ongoing and transparent and fluid back and forth. As for school districts, it's not going to change from what I can determine based on their planning. They're not doing robust surveillance per se, so it's truly related to symptoms, those not feeling well, and then they go and have a laboratory test done. That laboratory test result then goes into the NED system, National Disease Surveillance System, and we would know about it that way. However, if that is reported to the school district prior to it hitting our typical reporting through the laboratory reporting, they would communicate that with us, and we would start an investigation based on a laboratory report. So ideally, the open communication can make this happen faster than using traditional submission to the NED system. So a positive lab report starts an investigation on our end. I hope that helps bring a little bit more clarity to the question.
Just one quick follow-up on that. So when you get it from a lab report, does it just say, for example, a 13-year-old from Harbor Creek Township? It doesn't say what school that boy or girl would attend, does it?
The laboratory report has all of the same demographics that the lab is required to collect when they're submitting that sample. So school district data is typically not in the laboratory report, but during case investigation, we collect additional information that makes that whole case much more complete on the picture of where the individual is working or going to school, university, so on and so forth.
Thank you, David.
Oh,
and
thanks.
Jet TV, do you have a final question? Star?
For Kathy, yes. In regards to the schools, do we know how things are going in regards to the transportation with the school buses, with the students spacing out, as well as the school bus drivers?
From my understanding, we've had very few cases in any of our school districts. We don't see any major concerns in that regard, but I'm going to ask Director Lyon to confirm that.
Thank you, and you are correct, County Executive. I believe that transportation was one of the more challenging issues for school districts to plan for and execute. However, at this point, things are going very smoothly for the school districts. That's what I would like to reinforce at this time. We are seeing business as usual as COVID-19 has created. Thank you.
And last, Sandy from West County Journal, do you have a final question for us?
I do, and it may have been asked in a previous session, but the flu season's coming up, so is that a big concern for here in Erie County, and how can people differentiate between whether they have COVID-19 or the flu?
So that is a big concern, and what we've been trying to encourage people to do is to get a flu shot. If you always get one, get it as soon as you can. If you've never gotten one, get one this year. It's available now. It's available at most of our pharmacies, probably around the whole county. I know some businesses offer flu shots, and it is imperative that people get a flu shot this year because it will be very difficult to differentiate between the flu and COVID-19. And by the time COVID-19 hit Erie County last year, the flu season was waning, so we don't even know what that would be if someone was hit with both. So protect yourself, protect your family, protect the people that you come into. Get a flu shot this year. It is more important than ever that you do that this year. Thank you, Sandy. And I want to thank Director Lyon, as always, who brings obviously a great wealth of information with her. And I want to thank Attorney Rich Perhacs, the solicitor in my administration, for being with us today to talk about the most recent court ruling. And I want to finish with some of our star businesses. We have so many of them in Erie County. I could stand here all day and list them, but I'm going to just list a few today. Jay's Main Street Ice Cream and Hot Dog Shop in McCain. They have their signs up. They're requiring masks to be worn. Different windows are used for food and for money. So thank you to Jay's Main Street Ice Cream in McCain. The Werner Books at Liberty Plaza. Masks are required. Hand sanitizing station is located right inside of the front door. Sneeze guards are in place at the register. Thank you to Werner Books. And they also have a book quarantine area where the books are held for 72 hours after they have been handled, and you can also shop online there. If you have a purchase ready for drive-up service, they'll come out and deliver to you. And you can also go there solo shopping. So if you really are a person who is at risk, you can give them a call. They'll schedule a 30-minute shopping time reserved just for you. So thank you to Werner Books. And lastly, I had the chance to go out to Birch Farms, their country market in Northeast this weekend. Things looked great there with their social distancing, mask requirements. And they also have great picking. They said they've been busier ever, and I've heard that from other farmers in Erie County, that families, individuals are coming out and picking their own produce, picking their own fruits and vegetables this year. And what a great activity for all of us to do, to be outside, to be healthy, to enjoy the bounty of Erie County, and to support our local businesses. So I just suggest, if you haven't been out apple picking in a long time, 'tis the season. Go on out there and enjoy that activity this year. So thank you to all of our businesses who are doing everything possible to keep our community safe. You have been a huge part in Erie County remaining as safe as it has, saving lives, truly saving lives, along with everyone else who's working on this pandemic. So please continue to do your remarkable job that you've done for many, many months now. And finally, my final message, as always, is please try to stay as physically close to your home as possible. Practice good personal hygiene with hand washing and hand sanitizer. Stay away from anyone who is ill. If you are ill, please do not go out. And please remember to always wear your mask when you're outside of your home, away from the people that you live with. And as always, stay safe throughout this time, and please stay calm. Have a great week.